Give me the high-level summary. What is Mindmed up to?
Yeah, so Mindmed is focused on psychedelics, but we're looking at psychedelics in, I think, a different manner than a lot of people out there. There's been a lot of research, definitely on the trip component, and it as a psychotherapy. What we've seen is there hasn't been a lot of research on psychedelics as medicines that aren't trip-based. So we're going to focus on deriving medicines from these substances that really have been Schedule I drugs for a very long time, but just haven't had proper funding to look at them and understand how they can help people as take-home medicines. We want to send these home with people.
And how did you get involved in the psychedelic space, JR?
Sure. Well, that's a long, strange trip, but no pun intended. But
your background, you're an entrepreneur.
Sure. Yeah.
Right?
Yeah.
New to the capital markets, but are you new to psychedelics? Is this a new sector for you?
It's definitely a new sector for me. I have a fair amount of experience in looking at these and understanding them. So I was working in Silicon Valley for Uber, and a lot of my friends and colleagues were microdosing LSD. And it's really kind of a very big theme in Silicon Valley. So that was the first eye-opener for me. And I also started to notice a lot of my friends were using it with their addiction issues.
Okay.
And so I went through, after leaving Uber, I went through something called Y Combinator, which is a tech accelerator. And I was starting to see all these technologies out there that were basically going to put everyone in the room out of a job. Right? 800 million jobs are going to be lost by 2030. A lot of those are blue collar, but a lot of those are white collar. And when I started digging down in the data, as an entrepreneur, as a startup guy, we were like, wow, addiction skyrockets when people lose a job, but depression also does too. And so when I was looking to start my next company, this looked like a boom business because my friends were putting everyone out of jobs. So that was really the genesis of looking at this for the last 2 years, talking to all the researchers, and getting a pretty good handle on what's real science and what's not real science, because there's a lot of stuff out there and it's hard to sift through. And we've looked at 20 different projects before we sort of came up with the concept behind Mindmed.
Okay. And you mentioned your network back in the Silicon Valley, and we always hear about this, the microdosing trend.
Sure.
Talk about that a little bit for anybody who's not familiar with microdosing. What exactly are you discussing?
Yeah, so microdosing, it's not hallucinogenic. It's not going to cause a trip. It's basically at sub-perceptible levels, right?
Okay.
So what does that really mean? Yeah, you're not going into la-la land, but it's helping you focus. It's helping sometimes with depression. There's not a lot of data out there, to be perfectly honest with you. It could just be completely placebo. And so what we're looking at Mindmed is, I think, very soon we'll be doing something in the microdosing space and making some announcements about that.
And any compounds you can talk about that you're focused on?
I think LSD is a really interesting compound, and I think we'd probably want to do something around that.
Got it. Okay, now, because most microdosing protocols that I read about are generally like a 1 day on, 2 day off, integrate this into your life over time, maybe for 1 month or 2 months at a time, affecting some sort of emotional or psychological shift.
Sure.
Is that how you would define it?
Yeah, there's definitely something there, but again, I think there's like 3 studies around microdosing. It's pretty limited.
It's
right?
all very anecdotal.
It's very anecdotal. There's a lot of stuff online. But again, Mindmed is a neuropharmaceutical company, right? We're taking a very biotech approach to this industry, and we want to prove everything with data. We have great researchers that have experience in the psychedelic space, but we also have great drug developers that are clinical drug developers. There's a difference between a psychedelic researcher as an academic researcher and somebody who knows how to put a drug on the market that's actually going to help people. And that's one thing that I've really noticed over the last 2 years.
Yeah, I think that's really smart because we're talking about a sector that's essentially coming out of the bad dog box.
That's right.
We have no space for bad behavior, right? And
Correct.
so measuring every action is hyper important right now. And there's so many indications. We've talked about a handful up here. Do any stand out to you as the most compelling first case? Is it addiction, depression?
Yeah. So our lead drug candidate that's we're going for a phase 2 FDA trial is focused on the opioid crisis. It's a derivative of ibogaine called 18-MC. And 18-MC, so ibogaine, just to put this in context for your audience, is a psychedelic, right? So people might have heard about it in the news.
Ibogaine, it's a root grown in North Africa?
Right, so it's a shrub or root coming out of Africa. And it's used a lot in these addiction clinics in Mexico, right? So a lot of celebrities are going down there claiming that, coming back and saying, oh, it cured me. And so there was a lot of work done on ibogaine in the 90s, not necessarily very successful, because what people found, or what research found, was there was this cardiac risk association with ibogaine. It actually can cause a heart attack.
There is a level of, it's kind of stands out in the psychedelic plant world,
sure,
because it's one of the few with the toxic element to it.
For sure. And, that to us, I called up Ken Alper at NYU, and I said, Ken, or Dr. Alper, I want to start an ibogaine company. And he said, that's a terrible idea. And I was like, oh, okay. Why is that a terrible idea? And he said, well, yeah, do you know about the heart issues with ibogaine? And so he's been working on ibogaine. He's basically, he is the leading voice on this. And he said, you need to talk to Stephen Hurst and Dr. Freeman and Stan Glick, our scientific team, about 18-MC. Because Stan Glick in the mid-90s invented a molecule based on ibogaine that takes away all the issues with the heart from ibogaine, but also is non-hallucinogenic. And they've done a lot of work in that space, and they've gotten NIDA funding. So NIDA is the National Institute on Drug Abuse. They were given $6.7 million by the federal government for a psychedelic-derived medicine or psychedelic-inspired medicine. And I said, wow, that's kind of interesting. I haven't heard that from many other psychedelic companies that actually had funding for this. So we went back and forth for a while and basically said, look, I think this is the sweet spot. Let's do other things like 18-MC. We don't necessarily need everything to be a trip, right? So there's definitely merit in those trip-based psychotherapy sessions, like undeniable. But I don't think it's the end-all, be-all. I don't think you have to have a purist view on it. And so we want to put medicines on the market through the traditional pharmaceutical pipeline and distribution model, because we think we can make a really good business out of it. And putting drugs through clinics, like if you look at esketamine, for example, I think they had like 100 clinics on the launch. That's Johnson & Johnson, multi-billion-dollar pharma company. That's a tough model. It doesn't mean that you can't make a good model out of it, but we just felt our team wasn't set up to achieve that, and so we wanted to focus on go to your local doctor, get our medicine, pick it up from your local pharmacy.
Well, your comments about ibogaine really hammer home the real downside to prohibition, and that is that we don't have the ability to study and research these compounds and learn about them. And I just wonder, these risks, like the heart attack incident with ibogaine, would that have been an issue had we been allowed to study the compound, engineer out the negative effects? Anyways.
No, so totally, and one of the divisions that we're setting up in the company is a drug discovery component. And Don Gellert, as our chief scientific officer, just joined. He was previously at Eli Lilly. He put 19 molecules into their drug development pipeline. That's a lot for a clinical researcher. So I sat with him and he said, I'm going to make a better psychedelic, and I believe him. So
right. Okay. I could speak with you generally all day, but I want to get back to Mindmed a little bit because it's a very exciting company. And I want to ask you, how did you get Bruce Linton's attention? This is the guy in the cannabis industry, and he's now very involved with your business.
Yeah, so I mean, we saw, obviously everyone in the room saw Bruce left Canopy recently. And our lawyer, Perry DeLise, and Dan Davio at Canaccord said, you guys are doing something super interesting. I think you should talk to Bruce because he's interested in psychedelics. He's looking at a lot of deals in this space. He hasn't invested into one yet because he has some reservations. So you talk to him. So I called him up and I said, we want to build the canopy of psychedelics. And there was this really, really long moment of silence. And he said, okay, give me your 5 to 8 year plan on how you're actually going to achieve that and build a really big company. And we went through all those phases and the things that we needed to do. And the 5 minutes, they told me you have 5 minutes with this guy. That's all he's going to give you. Sure. That 5 minutes morphed into an hour. And by the end of the call, he said, I'm investing in your company and I'm coming on your board and joining you, which I think is, for us, a great accreditation.
It's a massive vote of confidence.
For sure.
He wasn't just the entrepreneur and the CEO, he became the ambassador, right? And the advocate that the media wanted to cover when they wanted to know what was happening in the cannabis industry. They would ask Bruce, not just about his stock performance, but about the future of the sector. And now he's transitioning to the psychedelic realm and joining your team.
Yeah, for sure. And, I think I'm going to look to him as a mentor on how we build a really big company. I want to build a $20 billion company. And he sort of drilled one thing into me. He said, focus on the data, focus on the IP, focus on the research, because that's what builds a moat. And that's exactly what we're going to do.
And that's why I love the story, because, and we've been through this rodeo in the cannabis sector, and there's a difference between entrepreneurs that come into the game as activists and stay activists. And you've told me that a couple times, that you want to build this into a $20 billion company. Talk about that a little bit. What's that path and runway look like? What are we looking forward to?
Well, I think we need to get some drugs on the market, and that takes time. But I think there's also, we need to have multiple psychedelic-inspired medicines in our pipeline, and be advancing those so that they get into phase 3s. Compass, a real thought leader in this space, has done an amazing job to take psilocybin, a clinic-based therapy, and get it into phase 3. I commend that, and we think we want to do something very similar with psychedelic-inspired medicines. You have to get them into phase 3s. That's how this game works. So definitely going to make some more announcements on what our plans are and all the great things that are coming into the company, because we definitely have a lot of stuff coming in. One thing I could say, if I had to invest into 2 psychedelic companies at the moment right now, I think it would be us and Compass, because I think we're taking a very clinical, data-driven approach to how this industry is going to perform in the long term.
So investors will get access to Mindmed if they want it shortly?
Yeah. We are, Canaccord is going to be championing our deal, I believe, and nothing signed yet, but we'll be undertaking RTO here in Canada. And
now, why Canada? Because you could have raised money in the Silicon Valley. Why are you up here?
So we've raised a fair amount of money out of Silicon Valley as well. So a lot of my friends that are looking at this space there, but we're up in Canada because I think the public markets offer a platform for us to become a very big company over the long term. And as we saw with Canopy and some of these other early cannabis companies, it was a very good platform. And I actually had this argument with a Silicon Valley VC. He was like, "Why are you doing an RTO? I mean, aren't those all terrible up there?" And I said, "You know what? They've made the cannabis industry, and I think you should show a little respect for Canadians, sir." Hey. I'm not Canadian, I'm American, just putting that out there.
I love it. Awesome. Okay. Thank you so much for joining us, JR. It was awesome chatting with you and hearing the story last night and sharing it with our audience. If people want to learn more about Mindmed, where can we point them?
They can email me or go on our website, mindmed.co.
Okay, awesome. Thank you so much. It was great having you up here.
Appreciate it.